In this picture, you can see placenta posteriorly. As you can see, the placenta here is located posteriorly, and you can see here a placental cyst. Clear sonoluscent area, and this is the border or the borders of the placental cyst, and of course this is liquor or amniotic fluid. Actually, let me give you an idea about that article about placental cysts I published more than 20 years ago. That was in the year 2002. Of course, when we are talking about the placental cysts, or the other name cytotrophoplastic cysts, by definition, placental cysts are sonoluscent areas that can be detected antenatally by ultrasound. They have a round or oval cavity, usually isolated from the placental circulation, and contain a gelatinous fluid. These cysts are located within the placental tissue, septal cysts, or under the fetal plate, subchorionic cysts, as you can see in this picture. About the prevalence, placental cysts are found in 20% of placentae examined at term. The etiology actually is unknown, and the differential diagnosis, placental tumors such as chorioangioma. Of course, choriangiomas are hyperechoic on ultrasound examination and rarely early vanishing twin. There would be an embryo, of course, inside the sac if it was a sac of an early vanishing twin. About the prognosis, most of placental cysts carry a benign nature and prognosis. However, their presence has been considered by some as an ominous sign when attached near the umbilical cord insertion, as the risk of umbilical cord constriction increases, and this may cause fetal growth retardation or restriction and intrauterine fetal asphyxia. About the management, usually no alteration of the obstetrical management is indicated, just follow-up of the cyst, and the cysts are usually subchorionic under the fetal plate or sometimes within the placental tissue, septal cyst. Antenatally detected placental cysts were usually benign, simultaneously samples of, if you can get simultaneous samples of cyst fluid, amniotic fluid, cord blood, and maternal blood collected 3 hours before delivery, and biochemical measurements of the cyst fluid, amniotic fluid, cord serum, and maternal serum, suggested by many authors that the solutes of cyst fluid do not originate exclusively from a single source. Pathogenesis, in addition, X cell synthesis and secretion into the cyst fluid may occur. Histopathological diagnosis prove their origin from trophoblastic X cells and confirm their frequent benign nature. Some authors stated that some of these cysts proved to be massive main stem villus hydrops with cisternal formation with no evidence of trophoblastic hyperplasia. In doubtful cases, placental mosaicism for triploidy should be excluded by DNA flow cytometry. About the common associations, placental cysts occur frequently in diabetes mellitus or maternal fetal rhesus incompatibility. There are records also of their association with the following cases as Beckwith-Widerman syndrome, hemochromatosis, intrauterine growth restriction, and so many other associations you can find. And so, actually, if you want to read this article, you will find it on the internet. Just write my name and write placental cysts, and you can read it, read it in details. So that was an idea about placental cysts, and this is how the picture is appearing by ultrasound antenatally. Thank you.